A clinical trial at UC Davis Health and 6 other sites showed that a cellular therapy offers promise for patients with late-stage Duchenne muscular dystrophy (DMD), a rare genetic disorder causing muscle loss and physical impairments in young people. The therapy appears to be safe and effective in stopping the deterioration of upper limb and heart functions. It is the first treatment to lead to meaningful functional improvements in the most severe cases of DMD patients. McDonald is the professor and chair of physical medicine and rehabilitation and professor of pediatrics at UC Davis Health. Cellular therapy for muscular degeneration in the Phase 2 clinical trial. The researchers used Capricor Therapeutics CAP-1002 allogeneic cardiosphere-derived cells, CDCs, obtained from human heart muscles. These cells can reduce muscle inflammation and enhance cell regeneration. The primary mechanism of the CAP-1002 therapy is to help reduce the disease's serious chronic inflammation problems, decrease fibrosis and improve muscle regeneration, and thereby maintain or improve critical heart and skeletal muscle function, McDonald said. The trial examined the long-term efficacy and safety of repeated intravenous infusions of CAP-1002 for the treatment of late-stage DMD. It enrolled 20 patients with DMD at 7 U.S. centers. The participants were at least 10 years old with moderate weakness in their arms and hands. They were randomly assigned to receive either CAP-1002 or a placebo every 3 months for 1 year, with a total of 4 infusions. Significant improvements in arm, hand and heart functions. The team assessed upper limb function using the Scale Performance of Upper Limb (PUL), motor function for DMD, heart function using cardiac magnetic resonance imaging (MRI), spirometry measures of respiratory function, and circulating biomark. The researchers assessed the PUL for the participants at their first infusion and after 1 year. They measured the change in the mid-level, elbow PUL scores between these 2 readings. The study found a significant favorable change in participants who received CAP-1002, compared to those who got the placebo. There was far less deterioration of upper extremity muscle function in the cell-treated group. The cardiac MRI also showed that the heart structure and function seemed to improve in participants who received CAP-1002. Here we show the promise of cell therapy in preventing the progression of heart disease in a rare genetic disease, but there is good reason to believe that such therapy may one day also be used for more common forms of heart failure, said co-author Eduardo Marbin, a pioneering heart researcher. Moving forward, McDonald and collaborators in other centers in the United States are launching a Phase 3 clinical trial, HOPE-3. The goal of this study is to confirm the efficacy of CAP-1002 in a larger cohort of patients. Patients with DMD typically lose their ability to walk in their teenage years and develop heart and lung complications as they age. Treatments for DMD are limited and there is no known cure. Current therapies that target skeletal muscles are not as effective in treating the heart muscle weakened by DMD. A therapy that stabilizes or reverses heart deterioration, while improving upper limb function, would be unique in its ability to address the tremendous burden of disease seen in advanced DMD patients. Therapies that address the later stages of the disease can make a tremendous impact on the quality of life for boys and young men with DMD and lessen the burden of care for their families, McDonald said. We worked with the Alpha Stem Cell Clinic and benefited from the stellar infrastructure of the UC Davis Department of Physical Medicine and Rehabilitation's Neuromuscular Research Lab and the Clinical and Translational Science Center, CTSC. The team also used the UC Davis Imaging Research Center to obtain cardiac MRI data on the trial participants. The trial, NCT 03406780, was sponsored by Capricor Therapeutics. Make a difference. Sponsored opportunity. Story source. Materials provided by University of California, Davis Health. Note: content may be edited for style and length. The Lancet, 2022. 399. 10329, 1049 doi, 10. 1016, S0140, 6736, 22, 00012, 5. Cite this page. University of California, Davis Health. https://ift. tt. Gin 0 RQH. Accessed March 10, 2022. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you technological news. Thank you.